to work.
So this is Yinka, and Yinka's coming in for her treatment.
There you go, there you go. See, she can't even get up.
And it's been a while since her last treatment. It's been 2 months. So Jennifer, when you first brought her in, when did you notice the improvement in Yinka?
So it was really, for me, it was right away. She really was able to get up and walk around a lot more. The first treatment, she was able to really get up and about, and then I would say after about 3 weeks of a treatment once a week, she was really much better, really able to walk a lot farther, and her personality was really back to her old self.
Because we were talking about, at the time, we were talking about, gee, she's miserable, and you were wondering how much longer she could go.
Yeah, she was really miserable. Her whole quality of life had gone away, and it was really a question of, if we can't find something to make her better, then really I have to consider putting her down. And this has just really been sort of the miracle cure for her, that it's made her able to walk and get around and be much more like herself. So it's, for me, I see a lot less pain.
So it is necessary to do the treatment once a week in order to keep her at that level.
Yeah.
And is she on pain meds right now too?
Yeah. No, she just takes the prednisone.
She just takes the prednisone.
So this is really her pain medication in a lot of ways.
And the prednisone, how much is she taking of that?
She takes 1 pill a day, I think.
So not a really high dose.
No. But we had her on a really high dose, and
it was just too hard on her.
That was too hard on her, so there was no quality of life in that. But the K-laser has given her the quality of life back.
Well, that's great. No, that's why we use it as a drug-free treatment to help older dogs that the drugs are hard on. And we go up and down the spine area.
With her, I go faster, doctor, because
she burns her hair.
She burns her hair. Yeah.
So Isabel's having to go a little faster than we normally do because her hair burns a little bit, even on the white coat settings, because we want to get deep down inside her spine where the nerves come out, like I showed you on the x-ray. And we're doing her hip where she's painful too, huh, Isabel? That's good. So that's what the laser's about. It delivers a beam of infrared light that stimulates the uptake of oxygen and the blood flow into inflamed areas. And sometimes we have other people that come with our patients. Hello.
She's much too young to need it. Okay, can you stand? Good girl. So she'll hop up into the car after this treatment too.
All right.
Which is amazing. Normally I have to lift her up, which is bad for my back.
So Yinka has arthritis in her back, and many older dogs have arthritis. We have arthritis too. It's arthritis is the loss of the cushions in your bones. Your bones are often covered with cartilage where they meet, whether it be in the hips,
whatever that is,
where it's covered with cartilage in the socket, or in the spine where they're covered with cartilage on the ends of the vertebrae. Or the disc is actually made of a cushion of cartilage-like substances, and they cushion the ends of the vertebrae meeting. When those discs in the vertebrae lose their elasticity and they collapse, then the disc can push out either above, as in this case, it will push out up, and it will make pain in the spinal cord or numbness where the dog may not feel its hind legs because the spinal cord is getting pinched off. That's one type of problems with arthritis in the spine. Another problem with arthritis in the spine is it can push out on the disc. The disc collapses, doesn't stay in its place. It gets pushed out and up and pushes on that nerve. When it pushes on a nerve, as you know, nerves cause pain, and you get something pushing on it or rubbing against it, it's going to make that nerve unhappy. An unhappy nerve is a painful nerve, and it causes back pain. How do we see that in the x-rays? So let's compare the disc spaces. So the disc spaces, if we see them from the bottom, the normal ones might look like this. These are the spacers between the vertebrae. When the spacer collapses, then the bones can rub together, And when they rub together, they form arthritis. Now, let's look on the x-ray. Well, these spacers are still fairly intact. There's not real severe arthritis developing there. But look at here. The body's producing bone below the vertebrae and making a lot of arthritis. So there is some back arthritis here, and possibly that disc in the back is pushing outward or upward and on the nerves that come out of the spinal cord right there and causing pain. Of course, when you first start out in any arthritis, you should use glucosamine chondroitin, which is a cartilage supplement to make the cartilage better so it doesn't collapse and it works better covering the ends of the bones. Glucosamine is always good to feed to any dog at any time, especially if there's signs of arthritis. Then after that, if there is a little arthritis or limping, I often advise for clients to try an aspirin. Aspirin's safe if you use it at the recommended dosage, 5 to 10 milligrams per pound, once or twice daily. If your dog has any vomiting or diarrhea, you have to stop the aspirin. Then we use the NSAIDs, such as Rimadyl, Previcox, Deramax, and those. Also, those can have side effects in a small amount of dogs, so you want to use that. You want to use it, but always make sure you use it at lower dosages and watch for any side effects. Then, when that stops working, then we use prednisone. Another therapy we see is we use the laser now. The laser is another non-drug way to cause the relief of pain. And Yinka's done real well on the laser therapy. So I hope you understood the video about the laser. As you can see in the diagram, it looks like it's shooting into my head right now, but actually it's shooting deep into the spine and causing the decreased inflammation and pain in the back. And with repeated treatments, it causes pain relief in many dogs, not all, because it depends on the dog, the depth of the pain, whether the laser can decrease inflammation. But it is a good alternative for those dogs and cats that can't have drugs, like the older dogs and cats. So it's something to consider. I forgot to mention in the video that you should always consider weight loss in any dogs and cats with back pain. That means feeding them better, moist or low-calorie food. You can check out my books, Dog Dish Diet and Feed Your Pet to Avoid the Vet, which has some ideas for nutrition in cats. And hopefully you understood that the back pain comes from arthritis, can be genetic, can be from too much weight, can be from trauma. Just if a dog's real active, it just wears down its joints. Remember that you can always give every dog and cat glucosamine chondroitin. It's just well, it's not raw, but it's joint supplements. It's covering its cartilage, and it will help nourish those joints. In fact, I feed my dogs and cats raw chicken, some cartilage, some raw shrimp tails. Those are all good sources of cartilage. Anyway, well, hope you understood what the laser is about, and a little bit more about back pain, because it's real common in us and all kinds of dogs and cats. So have a great day, and look up the K-laser if you're interested.